So, welcome to Voices of the Global Movement, where one voice can change a life. And today we have a special guest. Rachelle Burns is a committed leader in the field of behavioral health and suicide prevention. She currently serves as chair of the Florida Suicide Prevention Coalition and the Escarosa Suicide Prevention Coalition, as well as coordinator of the Mental Health Task Force of Northwest Florida. Rachelle is a public health consultant and coach through her company KM Consulting, KM Coaching, where she leads strategic projects in mental health, including suicide prevention training for Pensacola State College. She is also a passionate advocate and promoter of suicide prevention education. Welcome, Rachelle. I am honored to have you in this space.
Oh, thank you so much, Michelle. It's my honor to be here.
Rachelle, I know that you're a very busy person, and I have a couple of questions for you. If we can start the questions so that we can go straight to what I know people would like to know. And I ask a couple of people in my community to write to me their questions. So I chose a couple of them. And my first question is, what is the Florida Suicide Prevention Coalition and what is its mission?
So, the Florida Suicide Prevention Coalition is a grassroots organization that has been in existence for over 20 years. And it was started primarily by those who were loss survivors, people who had lost loved ones to suicide. But it has grown to others who are professionals in the behavioral health field, researchers in the field of suicide prevention, those who have lived experience perhaps with suicidal thoughts themselves, and lots of others who just believe in the mission of helping to reduce suicide in the state of Florida.
Okay. How would you describe the current situation of suicide in our communities? And what do you think are the main challenges we face?
So, unfortunately, suicide has continued to rise in the US and in Florida since the 1940s when we first started really collecting the data. Unfortunately, that hasn't changed, that we have increased gradually. I would say that the biggest challenge is related to help seeking and reducing stigma, because many times the reasons that people die, because it's a complex issue, but the reasons that people die have to do with sometimes not feeling that they can reach out for help, feeling stuck and trapped. And so I think the more that we can talk about suicide prevention and the more that we can talk about the importance of mental health and people taking care of themselves, then we are going to see those numbers reduce. I do believe that we will get to a point where we will see that change.
Okay, I understand. There is a silence, Rachelle, there is a silence that surrounds this topic.
Mhm.
From your experience, why do you think many people find it difficult or uncomfortable to talk about suicide? And how can we break that silence?
I think that it's difficult to talk about because we're still learning how to talk about mental health as a whole. People are very comfortable talking about physical health, and we wouldn't hesitate to go to the doctors if we have a physical health problem. But mental health has had so much stigma over the years that it's hard for people to push past that. And it's hard for us, therefore, when we have loved ones perhaps who we're concerned about, to know how to talk about it. And it's interesting to me that just feeling connected to people is one of the ways that we help prevent suicide. And yet it can be so hard to initiate that conversation. But it's a very simple thing to start. And it really comes from a heart of care and compassion for the person that you're talking to.
Yes. What is the most important action anyone can take?
So I have a couple of different aspects to answer this. One is that I would say that if you're concerned about someone, the most important thing that you can do is actually talk to them about your concerns. There's a myth out there that if you talk about suicide with someone, it will put the idea in their mind. That's a myth. It is not true. The fact is that people want to be heard, they want to be seen. So the most important thing you can do is talk to someone, share with them, say to them, I care about you and I've noticed that you're not yourself lately, or I'm concerned about you. I'm here for you. What can I do to help support you? And even if you don't know what to do, let them know that you care, because that connection with someone is the most important protective factor in preventing suicide. If you don't have someone in your life who is maybe struggling with suicidal thoughts, or there's no one that you're concerned about, but you just want to know what you can do to make your community a better place, to help save lives outside of perhaps your own sphere of influence, I would encourage people to take suicide prevention gatekeeper training. There's lots available. You can do it online for free. You can take it in person in your community. And if you go to the Florida Suicide Prevention Coalition website, there are multiple options there that can tell you how to connect with training so that you can learn what the warning signs are and then help someone know how to respond to them when they're struggling.
Yes, yes. And how can someone become a member of the Florida Suicide Prevention Coalition?
We have a membership page on our website. That's the easiest way, is just to go to the website, which is floridasuicideprevention.org, and go to that website and click on the membership page and become a member. We would love that.
Yes. What would you say to someone that it's in any field, any other career, let's say, even a stay-home mom, a teacher, a social worker, a construction worker, a nurse, a secretary, an attorney, a judge, a chaplain, spiritual leader, a student. What would you say? Why should everyone, it doesn't matter what they do, why should everyone learn about suicide prevention?
Suicide prevention is a public health issue, which means that it's everyone's responsibility. And we all have a sphere of influence in our lives. We all have people that we're connected with. When someone dies by suicide, it impacts over 100 people, about 25 of whom are significantly disrupted in their life because of that suicide death. And we can help prevent that, every single one of us, because we have people around us who are struggling. 1 in 4 individuals in the US struggles with a mental health issue. It's estimated that 1 in 8 to 10 have thoughts of suicide. And so chances are in your family or your circle of friends, you have people who may be struggling, but silently. The most important thing you can do is to talk to people openly and encourage them to get help.
Yes, definitely. I believe that too. And why should everyone become a member of the Florida Suicide Prevention Coalition?
I think there are multiple reasons. One is that that is something that everyone can do. If you are in Florida, or you have connections with Florida, or even if you're not and you just want to support the work, you can make a difference by joining. You also are then having access to a community that is like-minded, people that are interested in saving lives in the state of Florida. And we have a conference every year in February that is a wonderful place for people who are interested in this field and this topic to come together and support each other, learn new things, learn kind of state of the art and best practices. And it's such a wonderful way for us to connect with people who have similar passions.
And I was there this year, and it was so good. It was wonderful. Your work is very impressive, and your mission is beautiful. That's why I am so honored that you're here.
Thank
Uh,
you.
We know that, well, for the people that don't know, now September the 10th is World Suicide Prevention Day. And we are, I work with in the mental health field, and I work with a mental health clinic. We are also promoting educational campaigns in suicide prevention. And there's a community and that we call Voices of the Global Movement community. And we are inviting everyone to join these campaigns and to learn more about suicide prevention. And I think that, like you said, we are all part of this world, which right now with technology, the world is a smaller place. And I believe our voices can impact people from all over the world, right? So
Absolutely.
I believe in the mission of the Florida Suicide Prevention Coalition,
Thank you.
and I want to thank you for what you're doing. You're a very committed person, and I know that because I saw it when I was there this year at the convention. I saw how hard the team works with hardly no resources, financial resources. And this is why I believe that everyone should join and support the coalition. I think it's wonderful the work that the coalition is doing. And Rachel, is there anything else you would like to say to the people that are listening to this podcast?
I think that the message that I would really love for people to hold on to is that there is always hope, whether it's for you individually because you have struggled, or whether it's someone that you care about who has struggled, or perhaps a stranger that you meet, someone crying on the sidewalk or in a store that you can tell is distressed. We need one another. And I would say it's always better to err on the side of feeling like you're being intrusive and just show someone that you care, because that in itself can be life-saving. You can make a difference.
Definitely. I do believe that. Rachel, it has been such an honor to have you here, and I am so grateful that you took the time to be in this space.
Oh,
Yes, I would love to have you again here in this space at any other time that you are available.
thank you. I would be so honored to come back. It's been a pleasure.
Thank you so much, then. You take care.
Thank you. You
And
too.
thank you all to who is listening to Voices of the Global Movement, where real voices can change a life. Bye then.